This video will be treating repeated lateral ankle sprains in a high school football player. So once you get one, it's easier to get multiple. We're going to be injecting this PRP into the lateral ankle ligament attachments in order to cause those ankle ligaments to strengthen and help hold the ankle in a better neutral position so it's harder to sprain. Now, if you're not a complete member and you're watching this video, it's because this is within the first 2 weeks of posting. After that, I move them all over to the membership side. Membership is only $4.99 a month, and I have a vast library of videos. You can search through my page and see all the membership video titles and thumbnails. But if you want to watch them, you got to become a member.
All right, here I am palpating the talus just anterior to the lateral malleolus. And this was one of the spots on this patient that was tender. This spot classically does become tender with a lateral ankle sprain. The inversion of the foot ends up stretching out that anterior fibulotalar ligament. That's the first one that's likely to be damaged in an ankle sprain. So this pulls the distal fibula forward and the whole fibula downward, and can even strain all the way up through the interosseous membrane between the tibia and fibula. Now I'm finding the anterior aspect of the distal fibula. This is the fibular attachment of that anterior talofibular ligament, or the fibulotalar ligament. All right, and of course I'm touching bone first, then I'm aspirating and injecting. I'm injecting about 1 cc into each location. I do have a bit of lidocaine mixed in with this PRP, and I concentrated this about 7 times, meaning that the platelet concentration in a given volume of the PRP is about 7 times that of the platelet concentration in blood. All right, now we've switched to the medial ligaments. We're getting the anterior tibiotalar ligament. First, we're gonna get that talar attachment that's just anterior to the medial malleolus. This was also tender on palpation. And one can see that this ligament is also able to be strained during a medial ankle sprain because of the medial rotation that occurs in the talus. It's not as commonly strained though, but it was very tender on this patient. If you're noticing, you do see on some of these spots, now this is the distal anterior tibia. On some of these spots, I'm using a fanning technique where I'm moving back and forth and changing the angle slightly as I inject. This is also going to create some microtrauma at the bone where the ligament attaches to help stimulate the healing response. And now I'm going to treat the posterior tibiotalar ligament. First palpating the posterior tibia, finding that ligamentous attachment, getting my angle right so that I'm contacting that posterior inferior surface, aspirating and injecting. Then I'll go ahead and palpate the talar location here in a moment. Now, of course, if the talus rotates medially, so like if you're looking at the bottom of the foot, the rotation would be like the foot moving clockwise, then it's going to stretch the posterior tibiotalar ligament. It's going to lengthen that one. So here we go, right into that talus spot. And this patient is using nitrous for the procedure. Afterwards, didn't have any significant discomfort to report. But because of this, it's kind of hard to put him on his side. So for the next injections, you can tell it's a little tougher for me on my setup. I have to work a little bit to get where I'm trying to. So there I'm hitting the talar attachment of the posterior fibulotalar ligament. And next I'll get the fibular attachment. Again, you see me using this sort of pecking fanning technique. See, I go ahead and take his foot off the edge of the table so I can get it the right angle with the syringe. There you have it. If you have any questions, put them in the comments. And if you like this video, subscribe to my channel, press the like button, and become a complete member today.